Welcome back, and let's stay on the coronavirus with the nation's top infectious disease expert. He says Americans are getting infected with COVID-19 at 10 times the rate needed to end the pandemic. Dr. Anthony Fauci told Axios right now we're still in pandemic mode because we have 160,000 new infections a day. That's not even modestly good control, which means it's a public health threat. Joining us now is Dr. Anthony Fauci, of course, director of the National Institute of Allergy and Infectious Diseases and chief medical advisor to President Biden. Dr. Fauci, thank you so much for joining us this morning. It's a big morning. We now have this new plan from President Biden that we are grateful to be able to discuss with you. So, of course, the vaccine mandates are going to impact about 80 million Americans. But before these mandates, earlier this summer, the administration had seemed to shy away from mandates, and instead there was this big push on education and outreach on the vaccine. So did that not work? Did it only take us so far?
Well, I think the latter that you just said, it took us only so far. It worked to some extent. We did put, and still are putting, a big push on making it extremely easy for people to get vaccinated. Having trusted members of the community, trusted messengers to go out and get people to understand why it's important to get vaccinated, to make the vaccines very easily accessible, free, easy, convenient, safe. They work. So we did get a considerable portion of the population vaccinated, but now we have this recalcitrant about 76, 77 million people who are eligible to get vaccinated, who have not yet gotten vaccinated. And that is the reason why we are continuing to be in a significant uptick of infections. As I mentioned, and you put up on the screen, 160,000 new infections per day is not where we want to be. And we've reached a point where we've got to do something different. And that's what the president's speech was about when he spoke about the additional mandates. We hope when those mandates get implemented, it would also trigger a number of people to voluntarily come forward to get vaccinated, because we can end this. We have the capability and the resources to end it. We've just got to get people to step up and get vaccinated.
And Dr. Fauci, President Biden's mandate was not just you have to get vaccinated, full stop. It's also there's this option to have this weekly testing. You have to produce a negative test once a week. Let's say a company has a pretty large population of unvaccinated workers. Is testing once a week really an effective alternative to vaccination in keeping all workers safe? And I mean, for example, it was an option for federal workers, and now that testing opt-out is no longer an option. Is that because it's not good enough? It's not safe enough?
Well, the president was trying to strike a middle ground when you were talking about workers. I mean, the statement that was made that in individual enterprises that have 100 or more people working in that enterprise, that either you get vaccinated or you have regular testing. The optimal thing is just full stop vaccination. But since there's going to be obviously some pushback on that, on people who don't want to lose their jobs, but they really don't want to get vaccinated, the president gave an alternative. However, there isn't that alternative if you are a federal worker in the executive branch. It's vaccination or disciplinary action. So it isn't always, in every case, the option of getting tested. That's not so if you are a federal worker.
Let's talk about vaccine mandates in schools. We're already seeing more children test positive for COVID than any other time in the pandemic, of course, concerning to every parent in this country. I want to ask you about sort of a tale of two cities. In L.A., we now have this vaccine mandate in schools for children who are eligible. Meanwhile, in New York City, our mayor is saying we're not going to do that. What do you think about that? What do you think about mandating vaccine for children who are eligible?
Well, I'm in favor of that, and I'm in favor of what they are doing in Los Angeles. I think people should appreciate that this is not a new concept. This is not unique. There are many situations, vaccines that all of our children, I know my children, when they were at that age of going to school, they had to be vaccinated for measles, mumps, rubella, polio, and all the others. So the idea about requiring vaccination to attend school is not new with COVID-19. It's been around for a very long period of time.
Absolutely. One of the other things that came out yesterday, of course, is this mandate for healthcare workers. And along with that came a focus on the statistic of how many healthcare workers are not vaccinated, which is 27%, according to the COVID States Project. How concerned does that make you, not only for the patients of those healthcare workers or someone who's interacting with them, but in terms of vaccine hesitancy? I mean, if someone's nurse, if someone's doctor says they don't trust the vaccine, how can somebody who's being cared for by them trust it?
Well, you make a very good point, and that's why it's particularly disturbing when you see healthcare providers, doctors, nurses, and others not getting vaccinated to the extent that you just mentioned. I mean, 20+%, 27% is a very, very high number for people who are involved in the healthcare profession because they set the example for others. So that's one of the reasons why, when it came to hospitals that are associated and come under the rubric of Medicare and Medicaid, that people in those particular places have to get vaccinated. That's part of the president's 6-part plan.
And Dr. Fauci, I want to ask you about flu season, which we're heading into. How concerned are you? I mean, is this going to be a whole twin-demic on our hands, COVID and flu at the same time, especially with last year? I think it seemed to show that wearing masks also helped in terms of the flu, but we're seeing less masks this year. What do you think about flu season?
Well, we were very fortunate last year. It was unfortunate in that we had a lot of COVID last year, but one of the things, the positive aspects of it, not only for us here in the United States, but also for people in other hemispheres like Australia. Last year, we had the lowest level of flu in memory, not only for us here in the United States, but our Australian colleagues noted the same thing. And the reason was likely what you just said. People were very careful about the spread of respiratory-borne viruses, wearing masks, avoiding congregate settings, particularly indoors. And what happened is we had the spin-off of that was very, very little flu. This year, we hope that we have the same situation, that we don't get hit with a bad flu season. And that's the reason why we've got to continue to be careful. And even though we're vaccinated, when you are in indoor settings in areas of the country, which is essentially is the entire country, is in a situation where you have a high level of infection, you should be wearing masks even when you are vaccinated if you are indoors.
All right, Dr. Anthony Fauci, in his first live appearance on Morning News Now, thank you so much for joining us. We hope that you will come back. And I know it's a busy morning for you, so we appreciate your time.
Thank you. Good to be with you.
Thanks for watching our YouTube channel. Follow today's top stories and breaking news by downloading the NBC News app.